And we are live. Happy Tuesday. Good morning, good afternoon, or good evening, depending on when and where you're watching this episode of the Healthcare Leadership Show with Marion Spears Carr. That's me, your host. I'm so excited to be here on this Tuesday, like we are every week at 12:30, introducing the great, amazing thought leaders in my network and sharing them with my network and beyond. And today's topic is one that I'm very excited to talk about. It's after hours access, balancing patients, providers, and system performance. And my guest today is Cheryl Dalton Norman. She is the president CEO of Conduit Health Partners. And Cheryl and I just got to know each other recently. And Cheryl, I'm so excited about having this conversation. I know it's going to be a lot of fun. Introduce yourself to the audience and we'll just jump right into the conversation.
Well, thank you, Marion. I'm really excited to be here too. I'm Cheryl Dalton Norman, president and one of the founders of Conduit Health Partners. And I have been a nurse and worked in healthcare administration executive roles for 43 years. So I'm super young. And I love healthcare. I love making sure that people get access to the care that they need. I have 3 adult children, 2 who work in healthcare and 1 who's a kindergarten teacher. And I have 6 grandchildren, so I'm really excited about them as well. But I know today we're here to talk about driving access to care. And when I think about my family, that's one of the reasons that I'm so passionate about after hours access to care, and making sure that people get the care they need and that providers have the support they need and health systems are able to knowledgeably make plans for great patient care.
Well, you and I had a great pre-show when we discussed and we went off on a whole bunch of different tangents, and I suspect that's what's going to happen in today's conversation. If you're watching live or watching the replay, let us know in the comments where you're watching from, and in a little bit I'll give you an opportunity to post questions in the comment section. That comment section is the the heartbeat and the blood of my show. It's all about the interaction with our audience. So we're glad you're here. We got a lot of people that signed up, and we hope to see you in those comments. One of the things that I wanted to talk to you about, and I want you to talk about Conduit Health Partners and what you do, but really, I'd love for you to set the stage for our listeners. And my audience is typically hospital leaders, physician practice management people, private equity people, nursing leaders, a variety of healthcare leaders. That's the whole focus of the show. But talk about what the problem is, because I think one of the biggest things that you and I talked about, and one of the things I got excited about, was your organization solves a problem that is, didn't even realize for many of us who don't have to access care on a regular basis. We don't think about it. It's just an afterthought. And by the way, before we get started, John Wendling is checking in from Dallas. Thank you, John. Jennifer's checking in from the Netherlands. Thank you for being with us, Jennifer. Casey checking in from Orlando. Dominique in from Kentucky. Marlene, my friend Marlene Saunders, checking in from Metro Atlanta. Danielle from Ohio. We've got a lot going on. International show. Thanks to Jennifer being on the show. Cheryl, set the table for us. Talk about what the problem that your organization and what you are solving that many don't even understand is out there.
Yeah, I think where we really shine and where we really love working with health system and other employers, practice leaders, is we're solving for problems that sometimes no one even realizes is happening. So it's almost like a no news is good news kind of thing. So, well, sure, patients can easily and readily, speak with, someone 24/7, 365. Talking with a healthcare professional, that's super easy. You can do it anytime. And we make it super easy for our patients to reach us. We make it easy for them to get the healthcare advice that they want anytime, anywhere. I think we have that assumption, or we've lived in reality for ourselves and realized that is not really what's happening. So one of the things that we solve for, so in our transfer center work, we solve for health system access in that way. But in what we're talking about today in nurse triage, we are talking about people who need advice or help, who often would default to an emergency department, because in the absence of speaking with someone who's a knowledgeable registered nurse or provider, in the absence of that, we're going to take care of ourselves, or we're going to take care of our families any way we have to. And I often think, as someone who's been a nurse for a really long time and have worked in health systems, I know how to get help generally. I know people. And so, you know, I think it's easy for healthcare professionals to go, oh, well, yeah, I mean, we can get that. But people who live in rural areas, people who are marginalized, and frankly, people who don't work in healthcare don't understand how to access the care that's needed. And, you know, when my father-in-law, before he passed a year ago, I can remember just being completely demoralized because I was in a community where I knew no one, with a health system that I didn't know, who didn't offer nurse triage. And we were defaulting to the ED for him because we had no other options. And it's a sad place to be.
And, you know, I thought about the service that you guys provided in the context of where I live. And for those of you who have never watched my show or don't know me, I'm from North Carolina, but I live in the mountains of Georgia. And even though I'm only really an hour or so north of Atlanta, I'm 30 minutes from the nearest hospital. But I never really thought about that kind of access. If something, you know, thank goodness we're healthy up here, but if something happens, my option would have been to call my doctor, who's a friend of mine. He would answer my call, but I have that relationship, right? Most people don't.
Right.
I noticed, you know, just recently, my neighbor mentioned something I wanted to talk to you about, Cheryl. Her default was to call 911 and have an ambulance come there because she didn't know who to talk to, even though it wasn't somewhat of a non-emergent situation. Talk to me and tell the audience, how does your process work? So if an organization's working with you and you take these after hour calls, what's that process look like for the patient?
Yeah. Well, when we offer our nurse first triage, and let me tell you a little bit about our triage process is different than most or anyone else that I'm aware of. So we have registered nurses licensed in all 50 states. So no matter where you're calling from, we have a nurse that's licensed to take your call from that state. But we don't put anybody ahead of the nurse on that line. So the minute you call and that call is picked up, you are speaking to a registered nurse. So you don't have to wait for someone to call you back. Wow. You don't have to tell somebody else what your problem is and then get triaged to see if you can even talk to a nurse. It is an immediate access to a registered nurse, because we believe when people are experiencing healthcare challenges or family members are ill, anything, they are looking for help right now. And that's why EDs get overutilized. That's why 911 gets called, because I don't want to wait an hour to talk to somebody. I want to talk with someone because I'm fearful now. So when we work with a partner, and we have a great partner, large health system, Catholic health system in Texas that we work with, and they're amazing. And we work with all of their physician practices. And so as a partner with them, you know, they set up their phone queue to where people calling after hours, you get us if you need to speak with someone about your condition. So we're the people who take that call. And then what that's doing at the same time is making sure that physicians or their providers are freed up to do the work they need to do, while if there's something that we can advise the patients on, self-care at home, or if they do need to go to the emergency right now, we can even call 911 for them. So from taking care of yourself at home all the way to needing emergency care, we're able to get you to the right care and help you feel very confident about that. And at the same time, we're providing our client partners the data. So they know who's calling them, what time of day, what day of the week, what were the main complaints, what were the dispositions, where did we send them, how many patients were we able to redirect appropriately from the emergency room, so that we're keeping them in their care network, but not having to utilize the emergency room for non-emergent conditions. So that's kind of it in a nutshell.
What a great service. And I can think about, and John Wendling just got a question in the comments we're going to come back to in a moment about your connection to the rural health perspective. Again, coming from the rural health area, I can see where that's so valuable. And I do a ton of work in Texas, and that's a big state with a lot of rural care needed. I'm checking in. Danielle's checking in from Ohio. We got a big group from Ohio checking in. Melissa's checking in. Speaking of Texas, from DFW, Carly's checking in from Charleston, South Carolina. Good to see you, Carly. And Angela, Ohio as well. Southwest Ohio, Lamar Birch checking in. And Dusty Browning's checking in. Massive contingency in Ohio. And then Sandy Pauls is checking in from Kentucky. Let's jump to this question because I think it dovetails into exactly what you're talking about. How does your organization connect patient members with the right care at the right time? That's you just talked about that. Your organization seems well positioned for the rural healthcare transformation program. And for example, the state of Kentucky just received the first of its 5 payments of $219, but lives in DFW now. But so talk about how you're connecting in the rural health space. I don't know if that's a good question for you, but
it is a great question.
It aligns with what we were just.
Oh yeah, it's a perfect question because we do a lot of work with rural health, and one of the things that we think about when we think about rural health is and not just rural health, but any marginalized population where maybe Wi-Fi is not available, everyone doesn't have a cell phone, there may not be cell phone access. I mean, lots of things can happen in different areas of the country, but most people have access to, if nothing else, a landline phone. Some type of phone most people have. So we feel like that it's important that it's telephonic. Now, certainly we can do video visits. We have a lot of other capabilities, but at its core, the telephonic nurse triage, speaking immediately to a registered nurse, we work with a lot of FQHCs, federally qualified healthcare centers in the country, because providing in rural areas 24/7 access is really important to getting those federal dollars, and really measuring how are we impacting health in communities. And through the data that our analytics team is able to provide our partner clients, we're able to really provide not only data about, what are the conditions that are being seen and the volume of those conditions, but we're able to talk about where did people end up going? We're able, with different health systems, we're able to measure a lot of different things around utilization of care. So rural health is really near and dear to our hearts. I mean, we've helped, we've had nurses who've helped a dad deliver their baby with mom on the side of the road.
Wow.
Having, it's like, there are so many situations where you just need, and again, talking them through, being with them until an ambulance could get there. Those kinds of things are really important to us. And our nurses, it takes I think, a special nurse to do the kind of work that we do, because you have to be able to listen, hear. I mean, our nurses are really in tune to patients. I mean, they hear the shortness of breath. They're very clinically astute, and so they're able to make really good decisions utilizing Schmidt-Thompson protocols to, make sure we're directing people to safe care, and, really even thinking about where is the closest site of care for people who live in rural areas. Marion?
Yeah, welcome to the challenges of live broadcasting. There we go. But we caught the end of that. And I think I do want to talk about the nurses and how you train them, because obviously they're trained RNs, et cetera, but having to understand how to do that phone triage. But first, let me give a shout out to Evan is checking in from Florida. Evan, thanks for being there. And if you have questions for Cheryl, this is an interactive show, so we want your questions. If you have questions. But Cheryl, I was thinking about your workforce. You have nurses in 50 states, licensed in 50 states. And walk me through the process of how you prepare an RN who obviously has the clinical background, the experience, and from that side to moving from like a bedside environment where they're patient one-on-one to where they're on the phone with them. What does that look like? And I think that is also a differentiator of what you're doing. I would love for you to share that.
Well, we have a really great training team. We have two nurses who are just fantastic at training our staff. But even before we talk about training the staff, we really focus on hiring right. Fortunately, when you work for Conduit, you have the opportunity to work from home, which is very attractive.
Very attractive, yes.
But that's not the reason you should want to work for us, So, having a heart for people, being really patient, being able to listen intently and understand what people are saying to you and not saying to you, being really agile with different kinds of disease states, from pediatrics, cardiac, oncology, behavioral health. We're taking all kinds of calls. And fortunately, we're blessed to have hired nurses with skill sets across all those different areas. And they have the ability, while they are working, they can message each other and say, I'm dealing with this. And someone who is an expert in that can help weigh in. And so they really support each other. But when we hire people, the interview process is extensive. And we have them shadow. So you need to sit up and watch. What does this look like? What will you be doing? Because you also have to have really good computer skills, because you are multitasking and you're pulling up information and you're looking at things and you're listening while all of this is happening. So it's not a job for everyone. And we try to be very intentional in hiring the right people to do this work.
You talked about the relationship between your team and your organization and the companies that you partner with. What does that look like in terms of how you communicate with, let's say, a primary care practice who is working with you, and over a night time there's 3 patients that have responded to them, or 4, or whatever it is. What does that communication thread look like? How does that work? How do you share the information from the night before with the practice so they are aware that their patient has gone through a situation with you guys? What's that look like?
Yeah. So a couple of different ways. We provide truly exhaustive data. So if you don't know something, it's because you didn't want to look at it. So we make sure that the data is there. But for a lot of our clients, they're able to go into a portal and they can actively look and review things. We have account managers that are going over anything that's concerning with our clients. So, we have multiple communication methods. And for large health systems who have, I'll just say this, we're Epic experts. So for large health systems who utilize Epic, we have a lot of skills in that arena. And for large systems that have that, we will work directly within their Epic system. So it's seamless
Okay.
for the providers. It's just like it would be in their practice because we're entering and engaging in that way. So we also feel that it's really important to have regular touch bases where we go over the data with our partnering organizations to say, we've noticed these trends. And one of the things that, and as I mentioned, the large health system in Texas that we really enjoy working with, and we enjoy all of our clients, but I'm going to use them for an example. We were able to see, volume of calls coming in at a certain time, and their practices should have been open, and those calls shouldn't have been coming to us. So we help troubleshoot, a lot of different things to make sure that we're helping drive great operations as well.
That's exciting for me because the work that I do, as you know, Cheryl, is that I do advisory work and executive search work and leadership development work for those type of companies, physician practices, hospitals, et cetera. So it's nice that resource is there and that they can partner with you in that regard. Jennifer's checking in with this question. You mentioned earlier that sometimes healthcare administrators don't even know there's an issue when after hours access isn't working well. What's the first signal that executives usually notice? I guess what's the red flag? And what a great question from Jennifer.
I would say the scariest thing is not even on here because she led with patient complaints. And I think as a health system executive, the scariest thing for me would be the patient that never complains, that is either harmed or chooses to go somewhere else. And they never darken our door again because they couldn't get the access that they needed in the moment when they needed it. So I think, we solve for a lot of that. I think there is always a risk of provider burnout. And we work with a lot of great practices across the country. We love our clients. They're amazing. And we love our clients because they're demonstrating care for their communities by having 24/7, 365 access. But, we've gotten a lot of feedback from providers. It's just like, thank you, because I'm getting my life back a little bit at night. I mean, these are people who've gone into healthcare because they want to take care of people. It can be overwhelming when you don't ever get a break. And so what we're able to do is get people who really need to talk to them in the moment to them expeditiously, while making sure that others who need reassurance or who need other kinds of support, we take care of that. And that so that the physician can focus on, and the providers and the practices can focus on what they need to focus on in the moment. We want bedside caregivers working at the bedside, not doing things that could be managed away from the bedside. And we provide that expertise and that really a workforce that can enable the clinical workforce at the bedside to stay there and do that. And then we lift the rest of the work away.
So in my network is a lot of hospital executives, CEOs, hospital practice administrators, a variety of people that I've worked with throughout my career. And to your point earlier, Cheryl, I'm young too. I've been in the business like 40 years too. So we're still young, right? We're still young.
We're babies.
But if they don't have a program like this in place, and before we get off the show, we're gonna share how they can connect with you and Conduit. But what's some things that they need to go discuss? I guess to the question that you just answered. If I'm a hospital executive, what questions do I need to ask of my team, of my providers, of my patient access people, whoever, to understand what the problem might really be, how big a problem we may have? Because to your point, if the patient's going somewhere else and we never see that patient again,
that's a problem.
We may never know that.
Yeah.
So what's the steps of evaluating how big a problem that we have?
Yeah, I'll tell you what Bon Secours Mercy Health did. They recognized and they saw in the health plan. So I would even start as a large employer. I'd look at what was happening with my own benefit plan and see what the utilization was, and what was discovered within Bon Secours Mercy Health was that employees were sometimes going to the ED in the middle of the day during the week for non-emergent conditions. And being very thoughtful and proactive. I mean, once this was recognized, because some of it can be habitual, and some of it is just like, this is easy, but we needed, I think, the recognition of, we need to make it easier to do something else. And having, and at first, people are like, well, but I'm a nurse, or I'm a this or that. I know what I need and stuff. But within like 2 weeks of offering nurse triage for the employees of the ministry, everyone was like, oh my gosh, thank you. Because they're helping, our nurses are tracking down, where can you get diabetic, shoes and socks? Or we actually had an employee's child who called in and asked if we could help them with their school project. So, that's awesome. I mean, we can help in many ways. School projects generally aren't it, but but I think starting with your employees to hear what their experience of trying to get access to care looks like, or their own family members in the community, that's how you find out.
So to that point, how do patients find out about working with you? If you contract with a group, you partner with a group, how do you go about working with them to educate their patients? Because let's face it, I have 5 grandkids too, and we have an extended family and 5 adult kids, and their first response now to their healthcare is ChatGPT, which is terrifying. How do we get the patient to move away from like just grabbing their phone and putting their symptoms into ChatGPT and trying to figure out what's wrong with themselves, and actually pick up the phone and call if they have access to this service?
Well, there are a variety of different ways. When we work, if we're a community line, then they just publish the number for the community. If we're working with, specific practices, it's seamless, because we are always white labeled. No one ever calls Conduit. When you're calling, the partner organization, and as far as the community knows, they are speaking to someone from, Christus Health, or, Theta Care, or Bon Secours Mercy Health, or Nicholas Children's. I mean, you're speaking to someone from that organization, so you can build your queue that automatically gets people to nurse triage when they need it.
That the seamless white label part was a piece that I was wanting you to talk about. I think that's so important. A differentiator about what you do and how you do it. I told you this was going to go by fast, Cheryl. Yeah. And if anybody has any questions, we have about 3 more minutes. If you have any questions in the audience, please post them in the comments, and also we'll respond to questions afterwards. But if you have any questions for Cheryl, let me ask you this question. When you think about the future of the work that y'all are doing at Conduit, and what does that look like for you in terms of a company? What is the objective here? Obviously, you are a joint venture with, you mentioned Bon Secours Mercy, solving a problem for them. You've got these other clients. I guess, what's the next iteration of what you're doing? And the follow-up to that is, how can people connect with you to talk about this? Because I know there's going to be people in the audience that are going to want to learn more. So the first question is, what's the future look like as you continue to grow the organization? And then secondly, how can they connect with you?
Yeah. So obviously we do transfer center work. We do triage work. We also do some case care management work as well. Anything that requires RN licensure that can be done remotely. But one of the things that we're really focused on is the ethical and appropriate use of AI within, healthcare. And so, and AI is everywhere, and, people are talking about it everywhere. We believe that it has a place, but it is not a replacement for a compassionate, highly skilled registered nurse to work with people. So we are really looking at how can we expand our work to more organizations through the appropriate utilization of AI in the future.
Yeah, and I want to come back to the connection because I think Andrew Brinkley has a question. I think dovetails into the utilization piece, what we're just talking about. Andrew's checking in. Thank you, Andrew, for watching the show. Glad to have you in my network. Does Conduit provide resources or strategies for health systems to help remedy patients using the wrong type of medical resources, such as what you're talking about, ED over PCP? Andrew, great question. What are your thoughts? And we'll run long for that, Cheryl, because I think that's an important question to answer.
Yeah, I mean, that's really at the core of what we do. We also work for payers. So, payers are also always, why would we not use the most appropriate resource, which when it's appropriate is your PCP. We are not looking to separate a relationship from a PCP. We're looking to really drive the relationship with the PCP by making the PCP more available, more responsive, to patients. So and like I said, we measure where we are sending people. We look at what was the acuity of the patient. How many times did we, send patients to the ED? We measure, that very carefully, and we trend that with partnering organizations to say, what else can we do? We've done readmission mitigation work with different organizations. So, I mean, there are a lot of things. Fortunately, we have a lot of our leadership team has large system experience. And so it's not our first rodeo. We've seen some things and we like to work with organizations really to collaborate with people to make sure that we're helping our client organizations be more effective, more efficient, and more responsive to the care needs in their communities.
Yeah, I think we could do a whole show. So I'm going to try to see if I can get you back on the show, because I think we could do a whole show on just that topic, particularly around dealing with readmissions, dealing with habitual use of resources. And we haven't even scratched the surface on behavioral health challenges.
Oh, that's a whole different one. Yes.
Yeah. Andrew has another question in the comments. Cheryl, maybe afterwards, if you could answer his question in the comments, because we're out of time. I try to keep my show to 30 minutes. Andrew, great question. We do want to get you answered on that. Cheryl, how can they connect with you and connect with your team?
Yeah. Our website, www.conduithp.com. And just please go to the website, reach out to us. We work to be as responsive to people who are calling us for those kinds of reasons as we do to patients, and that's very responsive. So we'd love to hear from you.
Great. And if you're watching the show and you want to, and if you're not a first level connection with me, Marion Spears Carr, please send me a connect request, and I can get you the information to connect with Conduit as well. Please connect with me. Cheryl, thanks for being on the show. I hope you found it fun. I knew we were going to have a good conversation.
I knew we were going to have a good time.
Yeah, we had a good time. We were all over the topics. Thank you for all being in the audience. If this is the first time you're watching the Healthcare Show with Marion Spears Carr, please connect with me on LinkedIn. Watch upcoming shows we have coming on. We have a lot of great guests coming in March. I'm going to take a little bit of a break because I'm speaking at a conference in Texas next week. But Cheryl, thank you for being on the show. We'll close it out. And everyone, I hope you have a great Tuesday, and we will see you soon. We'll end the stream now. Have a great Tuesday.